Clarity Laser Vision live with Dr. Al-Ghoul, Surgical Director and Founder of Clarity. Today he's going to be talking a little bit about PRK. We do a touchless surface ablation here. I'm going to leave it to the doctor to give you all the details. Let's just give everyone a little bit of time to log in here. You were in surgery today already?
I was in surgery. I had a day full of various things, corneal procedures, transplants, cataracts, a whole host of things. But yeah, I'm excited to talk about corrective surgery.
Busy day.
Tonight. Yeah, definitely busy. But yeah, I wanted to kind of give a little bit of a background about PRK and the touchless form of PRK. A little bit of background about myself. I'm a corneal specialist here in Calgary, Alberta, practicing for almost 10 years here in Calgary. Clarity Laser Vision are a refractive surgery center, and we sort of emphasize on customizing our procedures for our patients. So it's a customized approach to correcting vision. In 2018, I would say we're very blessed to have so many different technologies at our disposal to achieve ultimately the 20/20 or better vision that we want to give for our patients. But it gets a bit daunting for our patients to try to figure out, which approach is the right answer. Every technique has its advantages or disadvantages, and navigating that requires, in my opinion, a corneal specialist to try to help our patients best through that journey, if you will. So yeah, PRK was approved in 1995 by the FDA. So it's been more than 20 years in the making. Basically what we're talking about is using this excimer laser, which has been around for longer than that. And the laser is pretty unique, has pretty unique features in that it allows us to do ultra precise ablations, where basically we can take the cornea here. If you look at this model, the cornea is a round structure, and this structure, which is about 0.5 millimeter thick, is ultimately responsible for most of our clarity when we see things. So in someone who's, for example, nearsighted, what we would be doing is we're trying to flatten the cornea from being perfectly round like this to being slightly flatter, and in doing so we achieve improvement to the vision. So PRK, when they first started doing PRK, they essentially said, yeah, let's just apply the laser directly onto the surface of the eye. But keep in mind that the top layer, the epithelium, is about 50 microns thick, and that layer regenerates. So we had to get it out of the way. So that's basically what PRK is in a nutshell. We're flattening the cornea, taking the epithelium out prior to that, and then we're letting the eye heal itself. So LASIK is a fantastic procedure, and the reason it became very popular is because of a few issues we had with PRK. PRK required a lot longer time to recover, because when you take out that epithelial layer, you require at least a week for the surface to heal, and then another couple of months for kind of full recovery. There was pain associated with PRK when you remove the epithelium. The cornea is 100 times more sensitive than any other part of the body. It's actually one of the most sensitive structures, if not the most sensitive structure in the body. So removing that epithelium created a lot of discomfort for our patients, which is again why LASIK became more popular. LASIK has this unique advantage of a lot faster recovery, minimal discomfort. And so you question, well, why even bother with PRK? And the reason is because there are certain advantages for PRK in certain patients. For example, someone's got a scar in their cornea. It makes more sense to do PRK as opposed to LASIK. But as a technology in of itself, the thing about our approach to PRK is now this notion of a touchless form of PRK. So what does that mean? Well, any procedure requires us to expect certain variables that will be involved in the process. For example, I'm a variable as a surgeon. Me doing the procedure is a variable. You recovering is a variable. The laser firing is a variable. So the touchless PRK is this unique proprietary approach that Schwind has, which is the manufacturer for our excimer laser, where basically we put an eyelid holder and I press on the foot pedal. So it's essentially an automated form of doing corrective surgery. So the laser is intuitive in the sense that the epithelium, which I mentioned earlier, that typically in a regular PRK requires us to remove, is actually done by the laser. So all that the patient experiences is basically sitting there and looking at the light, and I'm pressing on the foot pedal, and the laser is removing the epithelium, is doing the actual correction on the layer beneath the epithelium, which is the layer we want to be doing correction on. And then I'm basically putting a bandage contact lens, and then we're done. Average time, Elena, is about typically 30 to 40 seconds to do touchless PRK, which is actually faster than doing LASIK, because LASIK, we would actually require two lasers. One laser to do the flap, and another laser to do the correction with the Schwind excimer laser. But yeah, so in our practice, we actually do quite a bit of touchless PRK because with the Schwind platform, there's been many studies that have been published looking at the outcome of touchless PRK versus sort of LASIK, especially in the mild to moderate myopes. And what was interesting is we were able to achieve the same outcome 6 months out doing LASIK or...
Oh, there you go. Yeah.
We're live again.
Okay.
Okay, so we are live.
Yes.
Okay.
Where
Great.
did we leave off?
We were just talking about, for example, if you're joining the military and police force, certain professions, they actually would prefer that you do something like PRK over LASIK because of the very rare risk if something was to hit the eye. You know, there could be an issue with the flap that would require us to do some correction or repair. Whereas again, the PRK, you don't have to worry about that. Another point I want to make about the touchless PRK, we mentioned earlier about the issues of pain. We mentioned earlier about the recovery time. The reason why touchless PRK, and in general PRK, is starting to become more and more popular is because the laser platform now, we're now at the 6th generation or iteration of excimer laser technology. And so, for example, it comes with the Schwind laser. You know, this has got the smallest ablation spot size, and that allowed us to be able to do a very, very smooth treatment pattern that resulted in a much faster recovery for our patients. So typically what I will tell our patients is that by 1 week with touchless PRK, we expect that the far majority of our patients are at 20/40 or better vision, which is basically what you need to drive a vehicle. So that translates, when we do the TSA, we call it, or the touchless PRK, to people going back to work within a week, as opposed to the traditional PRK technique that required us to tell our patients to wait a lot longer. The other thing that's unique about the Schwind is that when we were thinking about how we used to manually do PRK, we would have to remove quite a bit of epithelium to allow for a laser treatment to be done, say, on a 6.25 millimeter spot. Because usually the amount of correction is done on a diameter basis. So, you know, if the cornea is about 10 millimeters, when we were doing correction on the cornea for someone's vision, we were doing about maybe on average 7 to 8 millimeters. 6.25 is actually optical spot, and then we extend it out to 7 or 8 to avoid issues like glares or halos at night. But if I'm going to be doing manual removal of the epithelium, you know, I can't tell exactly where 8 millimeter on the cornea is. So I'm going to have to remove almost 9 millimeters of epithelium from the cornea to do my 8 millimeter ablation spot on the cornea. So that means I'm removing more epithelium, which is resulting in longer recovery time for that epithelium to come back on the surface. With the touchless PRK, because the laser itself knows exactly how much epithelium to remove, it actually just removes what it needs. So that's why it's actually faster to recover now with this touchless PRK form over the traditional PRK. That, combined with the smaller spot size and the more smoother ablation patterns, has resulted to studies showing that, yeah, you can get faster recovery now. And that's why some centers, for example, they actually completely switched over to doing just PRK as a means of doing corrective surgery. Now, I don't personally think that's the right way to go. I think that there are still patients who are better suited for certain procedures over others. So that's why we still do lots of LASIK, we still do PRKs, we do ICLs, we do RLEs. There's a whole bunch of other technologies that really are best suited for certain patients over others. So yeah, I just wanted to kind of talk a little bit about touchless PRK, just to give you an idea of what is the latest version of PRK is like. I would say that, again, the far majority of our patients are quite happy with the touchless PRK. You can see in our reviews, a lot of our patients are actually patients who've had PRK. We've had, of course, LASIK, we've had ICLs, But in general, the journey is a lot more smoother than it used to be, 5 or 10 years ago.
That's right. When you're talking about the faster recovery, how much faster is it? Are you still going to tell a patient a month, 2 weeks? What time frame do you normally give them?
Yeah, well, I kind of think of it in terms of functionality and being able to work. I mean, I always say, look, if you're looking for the wow factor, there's nothing like LASIK. It truly delivers the next day almost wow factor that you get, where there's minimal disruption to your day-to-day flow, in work. But at the same time, there's that extra variable, making a flap, and there's, there are studies that look at, for example, the first year, there may be more incidence of dry eyes with LASIK as opposed to PRK. So a year out, there's been no differences based on studies. But if someone comes in with a history of dry eyes, we say, look, it may be better to do PRK than LASIK. So going back to what you said, I usually tell them, look, 1 week out, you're about 20/40 or better vision. So that means you could drive a vehicle, you could function. It's extremely rare that you actually need more than a week, and that's been our experience so far with our touchless PRK technique. But I tell them that basically, as the next week rolls, you're probably another line better. As another week roll, you're another line better. Mm-hmm. But I always want to kind of emphasize that to get absolute visual recovery to the levels that we expect it to be, it could take up to 3 to 6 months. But still, people are basically practically functioning really well by 1 week. And again, I'm always under-promising. I always like to do that. So realistically, honestly, a lot of our patients are better than 20/40 in 1 week. And, we have patients who even think like they've had LASIK because it just felt like within 3 days they're at 20/20 already, and they're not really seeing any difference, without glasses like they used to with glasses.
Yeah, we have a question from Gord here, and you kind of already answered it a little bit in that last one.
Yeah.
He says, I have dry eyes. What surgery is best for me?
Yeah, so that's where we kind of, when you look at the literature, right, we think about sort of the advantages of PRK over LASIK, because when you do a LASIK procedure, you are making a flap, which is cutting corneal nerves that require it to then regenerate. With PRK, you're not really going to be doing that, so then there's less likelihood, theoretically, of causing dry eyes with PRK than LASIK. Again, from the evidence approach, which is like what we like to do, when you look at the literature, at 1 year out, there has been no significant differences seen between LASIK versus PRK a year out. But in general, if someone comes in with dry eyes, we do actually advocate for PRK over LASIK, because even if it's just a 1 year situation, I'd rather that they be more comfortable through that year than to kind of than to deal with more dry eyes. And that's again this is me putting on the cornea hat, right? So there's of course and that's why I think LASIK is very popular. It's there's that sense of like, I want minimal disruption, but I like to think of it more of like what's best really for your eyes, right? So what's best for the cornea in that setting if someone's got dry eyes? Obviously, number one is we gotta address the dry eyes. Number two is determine that if the cornea is actually suitable for corrective surgery in lieu of their dry eyes. And if they've recovered with our therapies for dry eyes, which we could certainly talk about at another point, and they seem to be, the corneas are robust enough now to be able to undergo corrective surgery, then yeah, I would sort of advocate for PRK, again, provided they fulfill that criteria that we have for someone who is going to have PRK.
Yes, and we do a lot of testing, so for anyone who's actually ever inquired in our office, the first assessment is about a 2.5-3 hour visit. But most of the time you are meeting with Dr. Al-Ghoul, and he'll tell you right in the room which one he feels you're the best candidate for. So let's open it up now. Does anyone else have any questions for Dr. Al-Ghoul? We have him here for about another 15 minutes, 10-15, give or take. I know as the surgical coordinator, one question I always get about PRK is how much pain will a patient be in with PRK?
Yeah, that's a great question. So the actual procedure, you're not going to feel anything. To be honest with you, again, when you look at sort of the touchless form of the PRK as opposed to the LASIK, typically with LASIK procedure, we have to make that flap, right, which requires us to put a suction on the eye. That suction can feel like you have a little bit of a pressure feeling. Sometimes people feel a bit more than that, some people feel less than that, but there's some sensation that that you feel when you do the LASIK. Not so with the touchless PRK. The touchless PRK, we put numbing drops and we press on the foot pedal. You do not actually feel anything when we do the procedure. Now, afterwards is where we worry about the discomfort that could happen, right? And that's why we actually have a very, very methodical protocol that our patients go through, with various, medications. But honestly, at the end of the day, when they follow that, when I call my patients that same day, because I always do, and see how they're doing, I can't tell who's had LASIK and who had PRK most of the time, because we put them through so much preparation for the procedure with various medications and ways to kind of prepare for that. The far majority of patients have a pretty uneventful journey through that first day. But I always say still, like, the first day is the hardest day for either one, to be quite honest with you. So.
Yeah, but a lot of people will sleep through the first day. Is that true?
Yeah, the first day, your eye is gonna say, what just happened? Like, I'm in that phase of like, I need to like close my eyes and recover.
Yeah.
And so yeah, your first day you're going to be wanting to close the lights and just kind of rest. And then usually the next day is you're starting to realize, okay, I'm starting to see better. It's usually the next day with PRK people are seeing better than what they used to see typically before without glasses. And then it continues to get better and better. And again, the same goes with LASIK too. Like, of course, the next day they see a lot better too.
Right. Okay, another question we get a lot of is about computer time and screen time, both in the recovery and after they're kind of cleared. That they're said that they have that bill of, yes, your cornea has healed.
Yeah, so it depends again on which technique we're doing. If we're talking about LASIK or say ICL, I mean, most people are really fairly functional within by the next day, right? So, but we're still typically advising them, whether it's LASIK or PRK, to limit it to maybe no more than an hour for the first 3 to 4 days. Now, a lot of our patients are not like that. They're probably going back to work a lot sooner if they're feeling pretty good about it. But we still kind of typically recommend not doing too much screen time in the first week. But again, it just all depends on how quick they recover, how they feel, and kind of take it case by case basis that way.
Okay. Next question: if they are planning a vacation, how do they plan that around surgery? And should they be really cautious, because we're asking the eye to kind of regenerate some tissue with sunglasses, UV protection?
Yeah, so that's another key point when you compare PRK versus LASIK. We do say that, look, for PRK, there's a rare risk of the UV light causing some corneal haze. And typically haze is not something that you see, but it's typically something the doctor would see, but could eventually translate to you feeling like the vision is going down a bit. Thankfully, it can also be reversed if that was to happen. But we do know that UV light is a culprit for that, and that's why we recommend the first 6 months to always be wearing sunglasses. Which brings me to the next point, which is if you're outdoors, you really should be wearing sunglasses anyways, because the UV lights are very harmful radiations anyway. So in my mind, that's never been a big issue, because it's always been part of our recommendations anyways. But technically, you don't need to worry about that as much with LASIK as you do with PRK. So, but still, I would say that anytime you're outside, you should be wearing sunglasses.
Right. And of course, we give everybody those big, fancy wraparound sunglasses. So, let's see here. We have Shannon and Amira logged on right now.
How you guys doing?
And Gord, of course. Any questions? This video will be reposted after.
Yeah.
So of course we're going to be answering any questions potential patients have after it's posted. Trying to think of any other questions I normally get in the chair. Cover recovery time,
Yeah.
pain, kind of expectations returning to work, dryness. What about touch-ups?
Yeah.
What if someone has some of their prescription come back? Then what?
Well, actually, that's an interesting point. So we look at the latest literature when they talk about the need for touch-ups, whether it's LASIK, whether it's PRK, whether it's ICL, any corrective surgery. More and more literature is advocating for doing PRK as opposed to, say, lifting a flap if it was a LASIK patient. So, PRK is actually becoming more and more popular in that setting. If you were going to have a touch-up, you would sort of think along the line of doing PRK now. Because of lifting the flap, if you were to say, let's say you did LASIK and then like 5 years later you needed to do a touch-up, there's a risk that if you lift the flap, it could cause some issues with epithelial ingrowth. So a lot of centers, a lot of research is suggesting that it's probably safer to do PRK over LASIK. So
Okay, so even for someone who's had cataract surgery,
yeah.
that would be the best option then for enhancing.
Yeah, exactly, and that's happening a lot too. Well, not a lot, but occasionally we do get cases who, for example, someone opts for a multifocal intraocular lens, say someone in their 50s, and aiming for plano, but there's a bit of a refractive shift, and it's like a -1 or -0.75. It's rare that's more than that. They very nicely recover with PRK in these cases, and that's been our experience as well. Actually, I got a question asked the other day. A patient came to me and said to me, I was told by my friend, go for LASIK because your vision is going to be way better with LASIK than PRK a year out. It just doesn't seem like it's as clear with PRK. So I just wanted to kind of, again, dispel that myth. There's been, we look at the literature, there's no difference in outcomes for most patients who are getting corrective surgery with PRK versus LASIK. I will mention though that if you are a hyperope, that definitely LASIK is better than PRK. Again, that's going back to our point that it really is a case-by-case basis. Is taking the literature, taking the evidence, taking the data, put it all together, seeing a corneal specialist who then navigates which technique is better. So yeah, if you're a hyperope, we actually advocate for LASIK over PRK because studies do show it's more effective. Myope, typically, if it's less than -3, we say, look, you have the option for either PRK or LASIK, depending on the amount of recovery time. If it's more than -3, again, evidence to suggest that you're likely to get better outcome consistently if you did LASIK than PRK. But again, that's kind of a case-by-case basis, but just giving you guys a bit of a glimpse of how we kind of navigate our patients through these various refractive errors that we see.
Right. Okay. Any other commonly asked questions that you get?
That's a good question. I think the risk of they always worry about, of course, complications.
Yeah,
and,
what the risks are.
Yeah, of course. I mean, again, honestly, the risks are quite rare now because we're very methodical and meticulous in our patient care in general as a profession. So we're getting less and less of these issues that we used to have, when we first started doing corrective surgery. We've been doing corrective surgery as a profession now for more than 20 years. So clearly we've learned a great deal about, screening patients more effectively, treating patients more effectively, preoperatively and postoperatively. And so risks are extremely rare. They could happen, of course, but the key thing is, of course, to anticipate as much as possible what could happen beforehand. Having a very close communication with your surgeon, and that's what we really emphasize on with Clarity, is that we essentially, we're proud of that in the sense that every patient will have a direct access to me and to our staff if there's any issues. I think that really helps a great deal as you're recovering and minimize that issue.
Right.
And then, of course, there's that continuity of care that we continue to establish with our patients, week out, and then sort of have an open door policy to make sure that if you do feel like something is happening, we certainly you're welcome to come by anytime. We'll look at it and make sure it's taken care of.
We did get a question here, and Richard Kinnell says hi. So hi, Richard. He says, I know PRK surgery can have fluctuations in the vision after surgery. How long can I expect to have fluctuations in vision?
Yeah, that's a great question again. So the first week especially is where you'll see a lot of fluctuations happening. And that's again because the epithelium typically takes, in the range of about 24 to 48 hours for most of the healing takes place. It could take up to 3 or 4 days, but that's where, like, when we do the PRK, we're putting a contact lens on the eye, which is mimicking what an epithelium surface is like, and then when you add the the tear film, so then you'll get moments of like, oh, it's like super clear, and then other moments are it's like getting fuzzy because the epithelium is still regenerating. So the fluctuation is especially noticeable in the first week, and it gets less and less as the weeks go by. But you may experience fluctuations of vision potentially up to a month, or sometimes even a bit longer. But they do get less and less and less frequent as the first week goes by.
All right. That was a good question.
Yeah, that was a good question.
Thank you for that one.
Yeah.
We're nearing 6 o'clock here, so we're just about done here for Facebook Live. Again, this is Clarity Laser Vision with Dr. Al-Ghoul. I'm surgical coordinator here, Elena. I think unless we get a question in the next minute, we'll sign off and submit later. Send it out to everybody. So thank you for everyone joining us. If you know anybody who might find value in this video, please share. Like, comment our page. If you comment on here, or you can choose to follow actually, so that you know next time we're live. We are planning on doing this a little more often, right, including some live surgeries in the mix. So we will definitely update everybody the next event we plan to go Facebook Live. And that's it. Enjoy your evening, everyone. Thanks for joining us.
See you guys.